How big does the problem have to get before a federal government calls it industrial scale? Well, federal prosecutors and the FBI say the United States is facing a nationwide fraud crisis. Not isolated cases or regional pockets, but a coast-to-coast pattern of abuse across multiple federally funded programs. Minnesota's scandals drew attention, but investigators now say the same schemes are appearing in state after state with losses reaching into the billions. Started in Florida, where federal prosecutors uncovered a home health ring that billed Medicaid for more than $100 million in fake visits and forged signatures. In Texas, where autism therapy providers inflated hours, used unqualified staff, and billed Medicaid for sessions that never happened. In California, investigators found Medi-Cal kickback networks built around sham clinics and staged referrals. And in New York, mental health centers billed Medicaid for ghost appointments and therapy sessions that never occurred. The pattern doesn't stop with health care. Georgia documented child care subsidy fraud involving ghost children and fake attendance logs. Nevada found daycare centers inflating sign-in sheets. New Jersey uncovered kickback schemes where parents were paid to list their children so operators could bill the state for inflated hours. And pandemic-era fraud. Small Business Administration estimates that roughly $200 billion in PPE and IDL loans were fraudulent, the largest fraud event in American history touching every state. Federal agents say they're also seeing what they call fraud tourism, individuals traveling across state lines to exploit whichever state has the weakest oversight. One case involved two men traveling from Philadelphia to Minnesota because they heard the programs were easy money. Investigators say this mobility is part of what makes the fraud industrial scale. It's organized, opportunistic, and it moves. The message from federal prosecutors is blunt. These aren't small operations. They aren't clerical errors. These are coordinated schemes targeting Medicaid, housing programs, child care subsidies, food aid, and pandemic relief, the entire ecosystem of federally funded social services. Minnesota may have been the flashpoint, but the fraud problem is national, and Washington is now treating it that way. That's it for today. I'll see you tomorrow.